Kim Kardashian's new baby and all of the publicity has brought awareness to gestational surrogacy. Our fertility expert, Dr. Marjorie Dixon, explains exactly what that means. Thank you for breaking it down for us. There are so many Hollywood celebrities having babies. Sometimes it's out there that it's surrogacy, sometimes it's not out there. So it's nice to explain because I think that there is a lot of confusion about how it works.
Right, absolutely.
What is surrogacy?
So surrogacy means that through gestation, the child is carried by someone that's not you.
Right.
So there are two kinds of surrogacy. There's traditional surrogacy. So traditional surrogacy doesn't necessarily require the help of a reproductive specialist like me, because the person who is the carrier of the pregnancy is also genetically linked to the pregnancy.
Okay.
So you could essentially have the intended parent father's sperm or donor sperm inseminated into that person. The type of gestational surrogacy that requires someone like me for assisted reproduction is where the person who's carrying the pregnancy is not genetically related. So that means the intended parents, who for whatever reason can't be the people carrying the baby, or the woman's uterus can't be used, that woman's eggs and or donor eggs plus the intended father's sperm are combined in a laboratory through something called in vitro fertilization, which is why I get involved.
Right.
And then that embryo that's genetically linked to those parents is carried by a gestational surrogate. So she's essentially, you know, in the old days we talked about the stork, kind of.
She's the stork.
Yeah, a fancy baby carrier.
She's the carrier. So I'm just going to break it down. So if you look at this picture of Kim Kardashian with her family. So this is with her two kids that she currently had, and these were pregnancies that she carried herself. The third baby, it's her egg, it's Kanye's sperm.
Correct.
They come together, and they are carried by stork surrogate.
Exactly.
Okay, so genetically, if you look at this child has all the genetic DNA of the mother and the father, and the surrogate is simply a carrier.
Yes.
Okay.
And sometimes no.
And sometimes no.
Right, because not every family is the same. So if you're looking at Kim and Kanye, heterosexual couple, who can use her eggs and his sperm because she has good eggs to use and he has good sperm to use, use a gestational surrogate. But this also provides a multitude of other types of families the opportunity to grow their family as they see fit. So if you're a single man, for example, if you are a gay male family, if you are a transgendered individual, if you are a woman who was born congenitally without a uterus, if you have a medical contraindication to carrying pregnancy, for example, someone who has kidney failure or who has a heart problem that would not make them that would make carrying a pregnancy a risk to their health, wealth, and well-being. This is a viable option for them. So that's actually how it originally came to be. So, you know, from a medical perspective, we were offering our patients a safe way to have a pregnancy without putting their lives at risk. So we can, as reproductive specialists, do in vitro fertilization, stimulate the person who we're going to get the eggs from, and obtain the sperm through ejaculation, or donor sperm even, create the embryos in a laboratory. We can even genetically test the embryos for health and wellness before we put the embryo back in to whoever is going to carry that baby.
You can test for wellness, like DNA-related wellness at that level.
You can, just like you do for an amniocentesis. The same things you can test for in an amniocentesis, you can test for preconceptionally. It's called pre-implantation genetic screening. So when families go to these lengths, usually families that come to gestational surrogacy have really exhausted all other possibilities to conceive themselves. Some, if they know that they have a medical illness or condition that makes them know that this is how they're going to get pregnant, or you don't have a use, you know that's going to be the way. But often what I do see is couples who have been trying to have a baby for a very long time and it has not worked for whatever reason, who've had multiple failures, finally look to surrogacy as their option to conceive. I
want to mention a few of the other names that we might know that have had surrogacy in different ways. So Nate Berkus. So this is same-sex couple that had Poppy. I love Nate. He's such a sweetheart. Ricky Martin. So he has, with his partner, they had twins.
Twin boys.
Twin boys, and they're now, you know, they're much older. I want to talk about the twin situation. So do you say, hey, I'm putting all of this money and energy into this process. Could you please give me 2 instead of 1?
Patients will ask me to do all kinds of things.
Do you have control over that, doctor?
Absolutely, 100%.
You do?
Now, yes. So it's my job to make sure that I give my patients the right medical direction to make a decision that makes sense for them medically. And that's also right for 2 patients that become my patients. The gestational surrogate is my patient, and the intended parents are my patients.
Right.
And twin pregnancies can cause a great deal of problem medically to the surrogate, to the mother. So you're at greater risk of hypertension, of diabetes, of having a seizure, of having a stroke, of having a preterm delivery, of needing to be admitted to hospital for a period before you deliver. And that is why I recommend the elective single embryo transfer. And that's why, furthermore, we do test the embryos for any problems genetically. So the pre-implantation genetic screening allows us to select the embryos that we know are the healthiest, that will give the gestational surrogate the best chance of pregnancy, and the intended parents the best likelihood of the outcome that they're hoping for, which is 1 healthy baby at a time.
Okay. Okay, so this is moving away from surrogacy, but Mariah Carey and a billion other Hollywood stars, Beyonce, they've all had twins. So we can only speculate as to whether there was help there. But you can help someone have twins even without a surrogate?
Yes, but I think it's an important teaching point that when patients ask for twins because twins are sexy and twins are in Hollywood and twins are what we see a lot with assisted reproduction. In fact, we can use our expertise to minimize the risk associated with twins by educating people that it's safer to have 1 healthy baby at a time. So even though it worked for Beyonce and Mariah, those pregnancies are complicated and can cost a lot to you emotionally and toil on your family, on the healthcare system, on the babies and their long-term outcomes, because they can have complications related to their guts, problems with digestion, problems, cerebral palsy, respiratory problems through their lifetimes. So it's very important to not confuse what we want from an ideal perspective and what's safe medically.
I just like talking about it because I think if you just look at what's happening in Hollywood, everything looks so easy.
I know, I know.
Oh, I just decided I was going to have twins, and one's going to be a boy, and one's going to be a girl, and like we're famous, so that's how our life works.
And I think
so it's nice to get the real
deal. And I think for gestational surrogacy, what's really important for people to understand is you have to go to a physician or to a group that understands how to do this, because it's not just the medicine. There are legal implications. There are social implications. We have to make sure that the gestational surrogate is the right person to carry the baby and understands the psychological implications of handing over a child once you've carried it.
100%.
So you really have to make sure that all of the checks and balances are done, and you cross your T's and dot your I's. This can't be taken lightly. And do your due diligence.
Very good. Good information. Dr. Dixon.